Hey, welcome back to the halftime show, the Ortho Nebraska halftime show. And Ortho Nebraska, we always learn something new, and we learned something new earlier today.
Yeah, Gary, we always learn something new when we talk to Ortho Nebraska, and I can't remember ever doubling up on a subject. And today we have Matthew Tingle, an orthopedic surgeon, and we're going to talk about AC joint sprains. Doc, thank you. What exactly is an AC joint?
Yeah, happy to be here. So the AC joint is called the acromioclavicular joint. Now that's a fancy way of saying it's where the clavicle or the collarbone meets the shoulder blade or the point of the shoulder called the acromion. So AC joint, acromioclavicular joint.
And what are the most common causes of an AC sprain?
So the most common cause of an AC sprain is a blow or an injury to the side of the shoulder, the lateral aspect of the shoulder. Usually in football players in this scenario, they fall onto the side of their shoulder, get driven into the ground, but they're not able to protect themselves. So that direct blow to the side of the shoulder leads to an injury where the collarbone and that point of the shoulder actually tear or sprain the ligaments that help keep it together.
And so what does a follow-up look like?
So follow-up for AC joint injuries. Ideally, I'd like to see you within the first few days after the injury, no later than a week. But the key for this is to get the inflammation down in the actual area of the injury, and then allow the athlete to slowly begin range of motion once the inflammation and pain goes down. Ideally, like I said, is in the first week or so after the injury. For most common or low-grade injuries, we can get the athlete back fairly quickly within a few weeks to a month. More severe injuries obviously take a little bit more time, anywhere from a month to a few months.
All right, thank you very much, Doc. This is the band. We are in Elkhorn, where the Antlers trail 41-8. Waverly in the lead. We're back on the Ortho Nebraska halftime show right after this.